Anterior and posterior tongue tie. Are they important? Do you have to clip your baby's tongue at the age of 2 weeks? I'm Dr. Olga Dolghier. I'm here at Palm Valley Pediatric Dentistry and Orthodontics. I'm board-certified pediatric dentist and laser dentist. What is anterior tongue tie? I'm gonna show you on this little creature. He does have teeth, babies usually don't. So anterior tongue tie is when the tip of the tongue attach to the ridge where the teeth would be. So the only motions this tongue can do is sliding side to side. They cannot lift tongue up at all. Actually, when we see children with tongue tie, not infants, they cannot even bypass the border of your lip. They're limited, they cannot lick ice cream. A lot of times we ask mom, can your kid lick ice cream? They're like, oh, they don't like ice cream at all. And they might not like ice cream because they cannot stick the tongue out at all. Posterior tongue tie. Posterior tongue tie located in the back of the tongue. It's more controversial topic because some babies can compensate with the tie, and older kids we usually do not diagnose with posterior tongue tie. Posterior tongue tie usually we diagnose young children. It has to be multi-specialty approach, meaning that we exhausted all the options with lactation specialists, maybe even with chiropractor, and babies are not improving with sucking. Then we would look into posterior tongue tie as well. Posterior tongue tie usually located in the back of the tongue. If you lift the tongue high up, you can see the little stub of thick fibrous tissue under the tongue. And babies actually cannot slide and suck. They kind of chomp. Most complaint usually babies are chomping on the breast. They're not sliding and gliding that lower jaw back and forth because they are very restricted. What do we do with this? If we have a child who is deficient in certain letter pronunciations, they're extremely picky eaters. They usually say, oh, he doesn't want to eat meats. He just likes soft food, or he just likes French fries, doesn't want to eat anything else. So they usually are particular about certain texture because, again, remember the tongue motion is limited. So the tongue is just kind of sits on the bottom of the mouth and cannot do anything else. They are also mouth breathers because tongue should shape the palate. There's one of the theories that when we close mouth, the tongue should rest on the palate. So if you can imagine, if the mouth is closed and tongue is attached to the floor of the mouth, it's not shaping the palate. As a result, the kids usually open the mouth and breathing through the mouth at night. That can contribute to skeletal changes. Usually these kids are, we call dolichocephalic, they have kind of elongated faces. They're not breathing through the nose much, they're mouth breathers, increasing tonsillar tissue because the nose is for breathing and mouth is for eating, and that lymphatic tissue would increase with a constant exposure during breathing through the mouth to different type of pollutants, allergens, and so on. Have I seen kids who are tongue-tied and they had wide and big palate and have no deficiency in speech, no deficiency in eating? Yes, I have. But those mostly accidental finding. It's not, they don't have statistical significance because it's just somehow they compensate. But then later on in life, those kids who are anterior tongue tied with no symptoms, they might develop actual dental problems because the tongue is attached to the ridge where teeth are. So they would develop gum recession. So regardless, if you have ankylosing, anterior tongue tie restriction, when tongue is completely attached, it needs to be treated. Posterior tongue is different. Posterior tongue has a lot of controversy, and also we usually treat the babies who cannot compensate. So with the older kids, we don't look for that posterior tongue tie unless we have some other underlying condition. As a last resort, we look for it. So those are explanations about what kind of tongue ties they are there. Are they posterior? Are they anterior? Sometimes we call them Eiffel Tower. It's another type, and that's for a different story. And if you're interested in this video, I hope you subscribe to my channel, give us some thumbs up and likes, and if you want to listen about more tongue ties, complications, and what needs to be done if your child does have it, follow us and comment in the comments below. I'm Dr. Olga Dolghier. It was nice seeing you.